Hello, everyone. Thank you so much for joining in for today's session, which is on to cancer prevention for women. Okay. Cancer is that one word which creates the most of fear and anxiety above everything else, be it to some friend, be it to any unknown as well. Cancer is one thing that is the most dreaded. But the one most important thing that this session is for today is to create awareness about what measures, what guidelines have been introduced for prevention of cancers. Okay, so many cancers can be prevented by being detected early. Okay, so or treated successfully as well in some cases. But what is required mostly is the awareness specifically. Okay, so we'll go ahead with the conversation and why it matters. You'll get to know. Okay, then. So, you might have already been through so much, you might have heard so much about cancers, like how many number of cases there has been lately that you have been encountering in and around your society, that cancers has been the most developing disease here in India as well as of now. Okay. So, for women, when we talk about women, there are a few common cancers, okay, which we address. And to begin with, we are starting with cervical cancers, okay, which is the cancer of the cervix. So, you see in the diagram right here that cervix is this part which is the beginning of the uterus, okay, the lower part of the uterus. If you say it, maybe it is also termed as the entrance towards the uterus or the lowest part of the uterus, of course, okay. So, like you can see that it is ranked as the second most common cancer, raising cancer in India for women specifically after breast cancer. Okay, so we'll see what are the reasons towards this cancer and how it can be prevented. So, what causes the cervical cancer? It is human papilloma virus. Okay, so for people who might not have been familiar with this term, it is called HPV. If that is what you have heard of anytime, HPV vaccines or something like that. Okay, so HPV is one virus which is acquired most commonly, and some way or the other we always encounter it through our lifetime. For some people, it goes unnoticed. For some people, it finds favorable conditions and grows. Okay. But what is the most important thing to remember is that cervical cancers usually goes unnoticed. Okay. Has the least symptoms in the initial stages and shows up only at the later stages. Okay. How is it acquired? HPV, human papilloma virus, is specifically acquired through genital and skin to skin contacts. Okay, penetrative sexual intercourse is not necessary. It can be due to exchanging of bodily fluids also. And to come up with the newest information that condoms do not successfully protect you from HPV. But then comes everything after all of this fear that you might have heard as of now. Then comes the most important and encouraging part, that cervical cancer is preventable. Okay. What it requires is that you should be screening it, you should be getting vaccinated for it. Okay. Primarily, what happens is uh, we are very fortunate to be living in this time zone where the science has evolved so much that cancer, being the biggest disease we all know, can be prevented through a vaccination only. Okay, which is the greatest boon to the humankind as of now. But what plays the most important role is being aware about it. Okay, what are vaccines, when they have to be taken, who is eligible for taking the vaccines, and when is the right time to take vaccines. Okay, also, even if you have taken the vaccines, the next most important step required would be screenings. Okay. Screenings are done at different stages of life for different people, especially when women are sexually active. They can go ahead with pap smears. Okay. There's a certain hesitation, there's this fear and embarrassment among getting pap smears done. But I tell you, this is the most important step that you can make sure to be well aware of your health. And it, fortunately, it doesn't have to be repeated monthly. It is twice a year, it is thrice a year for adult growing ladies also. Okay, so make sure that you are keep yourself very much updated about what is happening into the world right now, and for which rather than creating fear amongst everybody or being a part of the fear mongering, the more you're aware about, the more you'll be able to help yourselves. Okay. So yes, then prevention of cervical cancers, not only by vaccinations, vaccination and screening is one step, but again, it is a lifestyle choice also. Okay. So cessation of smoking is one part. Barrier contraception is another thing. Okay. Then HPV vaccination schedule. Okay. It is there for girls aging from 9 years old to 45 years old. Okay. And 3 doses over the month and 2 doses if it is taken for girls less than 15 years of age. Okay. And has to be definitely avoided in pregnancy. And regular pap smears, which I already told is a very helpful measure to screen the cancer at its earliest stage possible. Okay. So next we are seeing that screening for cervical cancers above 30 years, pap smear has to be done 3 yearly. Okay, every 3 years. So it is not something that is a burden onto your pockets or anything like that. That how can somebody be so conscious and so without fear about getting tested again and again. So once you get your pap smear done, you are good to go for another 3 years. Okay. So likewise, another cancers can also be prevented with regards when it comes to screening. Okay. Co-testing for both the female and the partner can be done 5 yearly to lengthen the cervical screening intervals. Okay. Then coming on to the next most talked about and most feared about cancer, which women are encountering these days, is the breast cancer. Okay. So now let's talk about breast cancer that way. One most important misconception that comes with breast cancer is that it only affects women with family history, which is certainly not true. Many women are diagnosed with breast cancers, may not have family histories at all. Okay. This is why where self-awareness again plays the most important role. Okay. Please pay attention to everything that is happening to your body. Women's body is so sacred and ever changing. So everybody has to make sure that they experience, they touch themselves, they screen themselves. Okay, before even going to the doctor, before reporting any symptoms, be conscious about your body. Okay, let's talk about how and what can be should be done for self breast examinations. Here on the window, what you are seeing is certain positions which are the most suitable to check for breast cancer cancerous changes. Okay, so for the images that you see, the both the hands are behind your head, those are the things which cannot be done by yourself, of course. But once what you can do is you can do one breast at a time. Okay, and how it shows in the image, like look at the first image, how it is going. It starts right from the outer of the breast, circling inwards in a clockwise manner. Okay, palpating slightly, and then again from outwards to inwards, and then up and down, each of them. But what you are looking for is the most important thing. What you are looking for is any unusual breast lump, any nodule, or any cystic formation. That is the one thing. Okay. Any nipple discharges other than lactating women, any nipple discharges are abnormal. Okay, be it transparent white, be it watery, be it milky, bloody, anything. It can be anything, but any discharge, if you're not into the lactating window, has to be noted. Okay, any skin dimpling. What dimpling is? That your skin is retracted from within. Okay, any unusual pain that you experience, any change in the shape of your breast. Okay, so all of these things are to be noted. And don't be very regular with it, but at least once in a month. That is the minimum you can do for yourself. It is not something that you should be overly conscious about and to be doing like every 2 or 3 times a week, but once in a month it should be definitely done. Okay. Also, for the coming on to the screenings, the breast cancers can be screened through mammography. It is advised for women at the beginning of age 40, and also for the women who are transitioning into the menopausal windows. Okay, so for that, mammography is there, PET scans are there, but they are advanced treatment. So A basic self screening and a mammography should be enough to help yourselves. Okay. Then, most importantly, coming on to the prevention of it. Since we are talking about awareness and preventions, let's not forget how important physical activity plays a role in prevention of any type of health disease for that matter. Let it be cancer for this discussion, but any health disease can be mostly countered when you have an active physical routine followed by a very nutritious, healthy diet. Okay, reduce your lifetime weight gain by limiting calories again. Okay, and avoid alcohol and smoking as much as you can stay away from it, the more good it would be. Okay, so then what is the most important thing that you might have heard about the prevention of all of these? Few points I would like to address again and would love to conclude with it, that maintain healthy weight. Your diet, lifestyle, and good nutrition are the key to prevention of most of your diseases. Okay, and awareness creates the most strongest form of prevention. The more you're aware, the less fear you'd be surrounded with. Okay, so vaccinations, screening, and early warning signs has to be taken care of. And once, if you anyhow encounter any of these, go ahead with with your nearest doctor, get yourself checked, and please encourage women around you as well, your sisters, daughters, mothers, and friends. Of course, everybody, every woman deserves to be aware and to achieve the most important healthcare at the right time. Okay, so that's from my side for this session. Thank you, everybody, for being a part of this. And I'd love to entertain any questions if there are any. So I believe most of us has no questions, and most of it has been answered through the session only. So let's conclude this. Thank you so much, everybody, for joining in. Yeah.